Good evening, everyone. If you're joining us, we appreciate you being here. We know there's a lot of questions from parents and community members, and the district wants to do everything it can to answer those questions and address your concerns. For those that don't know me, my name is Adam Harith. I am the superintendent of schools here in OESJ, and I am joined here by a panel tonight, and I'll quickly introduce those in attendance as part of this panel. Sitting up front here is our junior senior high school principal, Mr. Kevin Warren. Right here is our elementary principal, Mrs. Carriga. In the back is our elementary nurse, Ms. Cheryl Brown. Our director of facilities, Jeff Schwartz. Our director of student support services, Kyle O'Brien. And over to my right is our director of technology, Greg Roth. So this is the first of 3 parent community forums that we will be holding this week. We have broken them down into sections to provide some flow and continuity, and so these don't drag on too long. Tonight, our topics of discussion are going to be on health and safety, which covers a variety of topics, on transportation, and on technology usage. Our next forum will be Wednesday afternoon at 4 o'clock, and the focus of that forum will be on instruction for students in grades 7 through 12, and for programs for students with special needs K through 12. And on Thursday of this week, the 20th of August, again at 6 p.m., the topics that we'll be focusing on will be instruction for students in grades pre-K through 6 and our food service program. So each night the panel will change slightly depending on the topic. And again, we felt that was helpful to kind of keep things organized and so that we weren't bouncing all over the place. Again, this is an unprecedented time that we face. We're not in this alone. Obviously, there are thousands of districts across the state that are all faced with similar situations. There are unique things from each district that have to be considered, and we certainly are doing everything we can to put together the best possible plan for the students and parents in our district here at OESJ. Along this process throughout the summer, I have repeatedly asked for your patience. And I certainly appreciate how patient everyone has been and the understanding that we're facing many challenges to reopening our schools to our students in September. And we are doing our very best and taking our time to make sure that whatever plan we put forth is one that we can certainly implement effectively. I've said it all along, the primary focus in this district is health and safety of our students and our staff. And we certainly are doing our due diligence to make sure that we're providing the safest possible environment for our students that when they return amidst the pandemic that we face globally. So again, it's been a trying time. I know there are a lot of questions. I certainly appreciate the feedback we've received on our question form. We've had roughly 92 responses, many of which have multiple questions. So that's a lot of questions. And some of them are redundant because obviously you cannot see the questions that other people have submitted. And we're going to do our very best to cover as many or all questions that we can cover that have been submitted. One thing that I would say, that Google form is still live, it's still active. So as I progress and as different people speak tonight, if you have further questions or want clarification, I would continue to use that Google form. Mr. Roth, our Director of Technology, is monitoring that Google form as we speak. So when questions are submitted and the form is updated automatically for us here live, we are able to address those questions tonight if they come up. And I will tell you personally, if we're not able to address the questions tonight, we will do so, whether it be in a subsequent forum later this week, where we maybe start off touching base on a few key questions that have come in since tonight, or if it's me responding or somebody else in this room responding individually to the parent as we are collecting your email addresses. So the bottom line is we want you to be heard. We want your opinions and your concerns to be addressed. We certainly very seriously take every question you have and all the concerns that you have. For those of you that don't know this, I also am a parent in the district. I have a daughter going into 7th grade, and I too have concerns. I think a parent that isn't concerned right now in the situation that we're in, it doesn't exist. I mean, we have a multitude of questions as parents, and I do too. And I think most of you already know that about myself here in this district. I live in the district, and I take being a parent very seriously, obviously. And I'm trying to approach this from the perspective that I'm trying to answer the questions that I have as a parent as well, knowing that there's a lot of those out there. So we don't, by any means, I can't understate the fact that your feedback is extremely important, and we're going to do everything in our power to address your questions and concerns before students step in our buildings in September. Just a little history here. The governor required us to release a plan on July 31st, and that plan was put online. We made it very clear at that time, and I will again reiterate this, it was subject to change. As a matter of fact, I think in one correspondence, I told community members it was very likely that it would change. Because at that time on July 31st, we were functioning with guidance that I can assure you has changed as we stand here today on August 17th. And that's been a real struggle from an administrative standpoint throughout this whole thing, is the fact that the guidance continues to change. It continues to update, and we're kind of scrambling at times where we feel like we have a plan going in a direction, and then something gets changed with guidance that comes down from the Department of Health or from the governor's office that requires us to adapt and change what we thought was a good plan the day before. So we're doing our very best to stay up to date with this. I would like to commend not only the people in this room and my administrative staff for the tireless work that they're putting in to keep up with this, but also the teachers and staff in the district as well. We've been in constant communication with our teachers union and addressing their concerns as well, and making sure that everybody's voice is heard. And this week is a big week for that in regards to parent and community feedback that we're receiving. So again, as hard as it is to say on August 17th that I'm asking for your patience, that's exactly what I'm doing. And I ask you with the utmost amount of respect for what you're doing as parents, and the understanding that goes into this, and that we're doing everything we can to get as much information out as fast as we can. But you know, one of the things I constantly say is I'm not going to put anything out to the public or to parents unless I'm 100% confident that I can pull it off. So while it may seem like a lack of answers to your questions, and while it may seem like maybe, for lack of a better way to put it, us dragging our feet, that is not the case. We are just doing our due diligence to make sure whatever plan we do put out there is designed with safety, and health and safety is the #1 priority, and we want to make sure we can deliver that to a parent, and we take the health and safety of your students very seriously. What we're going to do tonight, again, the 3 topics: health and safety, which is obviously the big one, transportation and technology. We're going to go through them, trying to organize the questions that we received and the answers we're going to give you. There are a few people that are going to step up to the podium and give responses as well that are more specific. You know, for example, our school nurse is certainly more of a medical expert than I am. And Mr. Schwartz, our director of facilities, has really done a great job of reading through the guidance on cleaning and disinfecting. And both of them are going to get up briefly to give a little overview. But at the same time, we want to go through some questions and do our very best to answer them. In the area of health and safety, we've kind of broken down, I would think there's 3 or 4 main areas. The wearing of masks was one of the big questions, and a number of questions came in on that. COVID-19 testing is another one. Contact tracing is another one, and obviously cleaning and disinfecting. As you know, we had to pull out 3 pieces of our plan: remote learning, contact tracing, and testing. We had to pull those out and post those individually to our website, which we did do last Friday. And along with the remote learning, which we're not really on that topic tonight, but there was a survey that went out. We're getting a number of responses to that as well. So again, everything we've put out, the participation, the feedback from parents has been phenomenal. And I can't say enough about how much we appreciate you being involved, actively involved, and supportive in the process. I'm going to start with the topic of masks. And again, many questions came through, and I'm going to run through what I'm seeing here and what we put together. One of the big questions is, will the district have to supply masks? And the answer is yes. We certainly are encouraging students to bring their own cloth masks or whatever mask they may have with them to school. There's a list of appropriate masks, and it's not a real long list, but the cloth masks, similar to the cloth masks that we were provided at graduation, the more like the surgical masks that few people in this room are wearing, are all masks that are considered appropriate. And I would encourage you to provide a mask if possible, but the district has purchased thousands of masks that we have on hand, adult masks, child masks, even masks that when the person's speaking, you can still see their mouth. So they have a kind of a clear opening in the front, not an opening, but a clear cover in the front. So it's still a mask that is approved, but it is a mask for students if they have to be able to see the lips of the teacher moving, which there are cases where that is necessary. So we have all different types of masks on hand to be able to supply students with a mask. We do realize even if a student does have their own mask, it could get dirty, they could drop it on the floor and no longer be comfortable with it. They could misplace it, they could lose it, they could forget it. And in those cases, even if they did have their own mask, the district does have the mask on hand to be able to supply students with a mask when needed. We will continue to purchase these masks as we go along. Like I said, we have thousands of them on hand. We're very comfortable with the surplus of masks right now when we reopen, and we will continue to, as we have, continue to look into purchasing more and more masks to make sure that we have the supplies necessary to keep up with the demand. So that's a simple yes. If a student needs a mask, the district will be providing one. When and where specifically will children need to wear masks? Questions off that question: classrooms, in the halls, physical education classes, in the cafeteria. The bottom line is the Department of Health guidelines is to maintain a distance of 6 feet. So in a classroom, we are designing our classrooms and spacing out desks that are appropriate to create 6 feet of social distancing in all directions. In those cases, if students are 6 feet apart, a mask is not required. Now, when I say required, it doesn't mean if the student is more comfortable leaving their mask on that they're not able to, or if teachers are more comfortable leaving their mask on that they can. It's just if there is 6 feet of social distancing being maintained, there is the ability at the teacher's discretion in the classroom to allow students to remove the masks. We're also building mask breaks of some sort into our day to allow students to alleviate that tension of having to have a mask on all day long. However, when a student is not able or staff member is not able to maintain 6 feet of social distancing in all directions, then a mask must be worn. And there is no exception to that rule. If there's not 6 feet of social distancing, the mask has to be worn. And it doesn't matter whether it's in the hallway, whether it's in the classroom. If there's not 6 feet of social distancing, the mask will be worn, and it will be worn properly. There are other areas, for example, transitioning times in the hallways, masks are required, regardless of 6 feet of social distancing. When using the restroom, masks are required, regardless of social distancing. Obviously, in cafeterias, students are not able to eat with a mask on. So if we do, and I'm not saying we are at this point, but if cafeterias are used in some capacity during the feeding of children, students will be spaced out a minimum of 6 feet to allow them to remove their mask to eat safely. But again, it all depends on the situation. So if it's not 6 feet of social distancing, mask is on and worn properly. In certain areas like going to the bathroom, in offices amongst the district, or transitioning between classes, masks are absolutely required, and there will be no exceptions. Can face shields be worn in the place of masks? No. There are situations where face shields would be permitted, but the recommendation that comes down is even if a face shield is being utilized, a mask must be worn as well. The only exceptions to that would be obviously cases, medical cases. If there's a medical diagnosis that it doesn't allow a student or a staff member to wear a mask, there are certain protocols that we must follow to allow that student not to have to wear the mask, but those are very specific medical conditions, and there would need to be documentation from a health provider outlining what those medical conditions are. But in the event of a face shield being worn, it is really not meant to replace a mask. It's just added precaution, added protection. Will kids have to wear a mask all day while in school? Are they allowed to take them off once they're at their desk? Again, there's going to be some redundancy as we go through these because there were so many questions, but I think I already covered this. If they're at their desk and maintaining 6 feet of social distance in all directions, there's the possibility and the option for the student to remove the mask at the teacher's discretion. But if at any time they break the 6 foot social distance rule, the mask must be put on. So if they were to get up to leave their desk to travel throughout the classroom, the mask must be worn. If they return to their desk and are maintaining that 6 feet of social distancing, then certainly the mask can be removed. Will there be physical education class and will children have to wear masks during it? The guidelines are a little bit different for physical education. Yes, physical education is still required. It's a graduation requirement, and we will still be providing. At this time, we plan on providing our physical education classes, but the guidance from the Department of Health is 12 feet of social distancing, not 6, so it's 12 feet when performing any type of aerobic activity. It's going to be very difficult and challenging for sure, but if a phys ed teacher is able to keep students 12 feet apart at all times, then there obviously is that option to not have a mask on. And obviously doing aerobic activity with a mask on is extremely difficult. We understand that. If there was an activity or something being done that did not require aerobic activity, then certainly, the phys ed teachers can take matters into their hands there and just determine whether or not, if there is 6 feet, the kids can have their masks off while they listen, or if it's closer than 6 feet, the mask obviously would need to be required. But again, if it's aerobic activity, it needs to be 12 feet, and there's no exception to that rule as well. I already discussed mask breaks. Yes, students may remove their mask on the direction of staff during meal times, and will seat it at their desk, provided they remain 6 feet apart from one another. And we'll do our very best to build mask breaks into our daily schedule. So I think that pretty much covers that topic of masks. I'm going to move on to cleaning and disinfecting. Before I get into some of the questions, just for a general overview, I am going to call up our Director of Facilities, Jeff Schwartz, and he's going to give a brief overview of the cleaning and disinfecting protocols that are in place, again, guidelines from the Department of Health. So, Mr. Schwartz.
Hello, Jeff Schwartz, Director of Facilities. When classes begin in September, all buildings will have been cleaned and disinfected, ready for students to return. Classrooms and other areas will have hand sanitizer and disposable wipes available for students and staff to use. Day custodians will routinely clean and disinfect high-use areas such as doors, hand railings, walls, and elevators. The bathrooms will be cleaned and disinfected every 2 hours or more often as use dictates being done. All schools have night cleaners that will clean and disinfect all classrooms, bathrooms, halls, offices, and any other areas used daily, and have the buildings ready for use the next morning. The district has also purchased Clorox 360 electrostatic sprayer units that deliver disinfecting solution to the front, back, and sides of all surfaces. We will be following all of the Department of Health guidelines for cleaning and disinfecting of the public facilities. Thank you.
Thank you, Mr. Schwartz. And just to go off of some of the things that he just covered, there are different cleaning guidelines depending on different things that happen throughout the day. And again, Mr. Schwartz, please interject if you feel the need. Certainly, one of the issues that we have between different buildings is whether or not we can keep students in cohorts. If students are kept in cohorts or groups, there is the ability for the students to not have as much transitioning throughout the day, and instead the teachers are moving to them. That eliminates the need of, so if a student's sitting at a desk that is 6 feet apart in all directions from other students, and that student is the only one using that desk during that time period, it eliminates some of the need to clean and disinfect as much. However, it doesn't mean that we're still not in those areas going to look, for example, if the students did have to leave the room to transition to somewhere, that provides the ability for those desks to be cleaned and wiped down, which would be done in combination between staff in the classroom and or our maintenance and cleaning staff. The challenge more at the high school level, where you're not able to keep kids grouped during cohorts because you have mixed grade levels, becomes the transitioning between classrooms. So for example, I'll use an example. A student is sitting at a desk in a classroom period 1, and that student gets up to leave the room to go to another class, and second period, a new student comes in to sit at that desk. I can assure you that between any use of a student desk, between one student and the next, that desk will be cleaned. There will never be a situation where a student sits and uses a desk for a period of time, whether it's 40 minutes or 80 minutes, depending on the instructional model that we're in, and another student will come to use that desk without that desk being properly cleaned. We are making every effort in both buildings when there is transitions to kind of create some kind of a lapse in time between usage one period and usage the next period, so that there's some more time for cleaning and disinfecting. But even if there's not that time regarding, one period and then the next period, there's more kids coming in, we will be doing everything in our power to make sure that those desks are cleaned. So again, I can assure you as I stand here that we're not looking to have students sharing desks without those desks being cleaned and disinfected in between periods. And we will have the cleaning materials on hand in the classroom, and we will certainly be communicating with our cleaning and maintenance staff to know where to go and when to go there to make sure that that cleaning is taking place. But again, if it's cohort driven, and the student's the only one using that desk for a length of time, then that's really not as necessary. When it comes to high use areas like Mr. Schwartz mentioned, door handles, for example, those will be cleaned periodically throughout the day. And I believe with bathrooms, which obviously are high use area, it's every 2 hours. It's every 2 hours that those need to be cleaned, and we will maintain a log and a schedule of when that cleaning took place and who cleaned it for accountability to make sure that we're properly tracking that. So again, going off what Mr. Schwartz said, we've purchased more advanced cleaning equipment that can be used and certainly enhances our cleaning abilities. Not to mention the stockpile of supplies we have when it comes to disinfecting wipes and sprays and all different types of materials that can be used to be able to clean and disinfect areas that students are touching or staff is touching. Getting into some more specific questions, how are the classrooms going to be disinfected when students change classes? I think I covered that. When they're not changing classes, it creates a different situation, but when they are, there will be time allowed to clear the room, disinfect it, and basically before the next group of students comes in. In regard to transportation and disinfecting, the buses will be cleaned and disinfected in between each run. So obviously after the AM run, the buses must be cleaned and disinfected. And then after the PM run, the same thing. So after each use, the buses will be cleaned and disinfected. There will not be a situation where students are on a bus, they dropped off at school, the bus just sits, nobody cleans it, nobody touches it, and then a different student was to go sit in the same seat. We also are making every effort to make sure that in the AM and PM runs, students are sitting in the same seats so that there's not students sharing seats, but we're still going to clean and disinfect between runs. I pretty much covered the protocol for cleaning bathrooms. Obviously, the bathrooms are shared. There's no way to provide a bathroom individually for each student, so that cleaning will take place. We're also going to obviously do our very best to educate our students and staff on the importance of hand washing and proper hand washing. So we will be purchasing and putting up signs that really go through the particulars of how to effectively wash your hands and clean your hands, and those will be posted in the bathrooms and around areas where that takes place, and be providing, having conversations with students about how important it is to wash your hands, because it's considered the single best deterrent from spreading infection, as it is with everything, is washing your hands. Not to mention the fact, and Mr. Schwartz mentioned this, the supply of hand sanitizer that we have. We've also stockpiled that, and hand sanitizer will be available in classrooms and high use areas and around the building, so that students have a multitude of options to be able to use hand sanitizer as well. But again, not my recommendation from the Department of Health. Hand sanitizer is not considered to be something that should replace proper hand washing. If it needs to be used in a situation, it's fine, but it should be used in addition to proper hand washing, not to replace. Will all staff members and teachers be cleaning desks continuously for the students throughout the day, several times a day, instead of students having to do it? Again, I covered this. The cleaning of desks will be done throughout the day by a variety of staff members in and out of the classroom and our maintenance staff, and it will comply with all Department of Health guidelines. Students will not be performing the cleaning duties. I would ask that students be responsible for proper hand washing and using the hand sanitizer and just following good health hygiene practices, but students will not be doing the cleaning themselves. That is something the district will be planning for and taking care of. As far as ventilation and filtration systems, the ventilation systems in the schools are all working properly. They're something that we are constantly monitoring and updating and making sure that they're working properly. It's not something that we've checked and we say, oh, they're working, we're good. I can assure you that Mr. Schwartz and his staff are continuously checking the filtration systems, making sure that they're working properly. And right as of this time, we have the most appropriate filters for the building units that we have. How will ventilation work within the school, both during warm and cold months? NICET and the Department of Health sets a required minimum damper openings to allow for continuous outside air intake into all rooms throughout the building through the unit vents that are located in each room. It is the same outside air intake for both warmer and months and colder months. The only thing that I would add on to that is obviously when weather permits, as much as we're able to, leave classroom doors will be left open. Windows can be used and left open to create airflow. And we also would try to our very best whenever possible to be able to take students outside when appropriate. It's not always appropriate. Certainly not going to say we have the capacity to have a multitude of outdoor classrooms, but when permissible, if students are able to go outside, certainly it makes it easier to space apart. It's a little bit cleaner air outside, and it is something we'll definitely consider as we move forward, and we'll be talking to our teaching staff about that as well. As far as what the district is doing to minimize the spread of the coronavirus in school, currently the most effective way to reduce the spread of the virus that causes COVID-19 is using multiple mitigation strategies in combination. This will require a coordinated effort on the part of schools, families, and staff. These efforts include having students, teachers, and staff stay home when sick, appropriately covering coughs and sneezes, wearing cloth face coverings, maintaining social distancing of at least 6 feet, cleaning and disinfecting frequently touched surfaces, and washing hands often with soap and water, or using an alcohol-based hand sanitizer with at least 60% alcohol content. Again, you can tell I'm reading that. Most of the guidance we're getting is directly from the Department of Health or the Center for Disease Control, making sure that we're following all the guidelines coming from these agencies, which are the governing agencies when it comes to following these protocols. And I can't assure you we have really immersed ourselves in that information, from building principals to nurses to maintenance staff to the superintendent to support staff to teachers, have really immersed themselves in what that information is to make sure that they're doing everything that we're supposed to be doing. Moving on to contact tracing, the next area. And I think before I get into this topic, I'm going to ask Cheryl Brown, the elementary nurse, to come up, and she's just going to share a brief overview of some of the stuff from her perspective. Sure.
Okay, with contact tracing, basically we will not be doing it in the schools. It's being done by the Department of Public Health, whether it's Montgomery, Fulton County, which I'm sure will be working with both of them very much. Contact tracing will be done if there is a confirmed case in the building. And like I said, it is the Departments of Public Health that will be coordinating those tracings. And just to make you aware, if you are receiving a call from them, it will show up on your phone, New York State contact tracing. Please answer the phone if you were to receive that, so that you can get the information that you need from them. They will guide you along the way. The other thing is question that keeps on coming up is about COVID testing. COVID testing is not required to be done prior to the start of school at this time. Again, COVID testing will not be done in school. It will be under the guidance of your healthcare provider and the Department of Public Health. If it is required to be done, they will give you guidance on what needs to be done, where you need to go, all that information. So again, yes, we need to be aware of the contact tracing and the COVID testing, but again, it will be under the Department of Public Health. And one last question that came up about rapid testing for COVID. It has just recently been FDA approved, but how fast it's going to be at sites or available in your healthcare providers, I don't know the answer to that at this time. Thank you.
Thank you, Mrs. Brown. And again, I think that the key point there is to make sure you understand that we're in constant contact with our local departments of health. OESJ is a unique district. We have 2 buildings that fall in 2 different counties. So the junior senior high school actually falls under the discretion of the Montgomery County Public Health Director, and the exact opposite, the elementary schools in Fulton County. And Sarah Barenko, the Public Health Director in Montgomery County, and Laurel Headwell, the Director in Fulton County, have been to meetings that I attend. We meet with them regularly. When we have questions, we contact them. When they have questions, they contact us. So I can assure you we're in constant contact with our local public health directors, who even have a greater access to information from the State Department of Health than we do. And I could, to a point where I almost feel like I'm bugging them sometimes. If I'm not sure of something, I call them because they certainly are more of an expert than I am. And whenever there's a doubt or a question that we come up with, we certainly reach out to them to get the answer. So again, I thank the county health directors. They've been phenomenal to work with, and certainly have a tall task in front of them as well. But we work very well with them. They've been very supportive, and I have zero concerns in that area. So that's a really good partnership for us to have. Going on to some of the more specific questions on contact tracing, and again, I apologize if there's some redundancy, but we're trying to be thorough. If there's a positive case in a classroom, will other students in it have to quarantine at home? The best answer I can give is the Department of Public Health will guide us on the protocols that will need to be followed for quarantining students and staff. So in that situation, if that comes up, my first phone call is going to be the Public Health Director. Once we realize that there's been a positive case, and we will follow all recommendations that the public health official in Montgomery and Fulton County and the guidelines from the State Department of Health. They're outlined pretty specific for us. And all I can tell you and assure you is whatever guidelines we're expected to follow will be followed to a T. If a child or staff member tests positive for COVID, what will happen to the students and staff that have come into contact? It's getting a little bit redundant. Will they need to quarantine? And again, that will be decided by the public health department. That is not a local decision. That is something we make a phone call, we get an answer, and we implement whatever it is we're told to do. And certainly they would be responsible for contacting, and we will do everything we can to support them. So if either one of them ask whatever we can do, we're going to provide them with all information. Remaining, students' names and identities remain confidential, but we will certainly be working with them, and they protect that confidentiality as well, to make sure that whoever needs to be contacted and following any protocols will be doing so. Is the district going to force a COVID test if a child has a symptom? The answer is no. No, we can't. And that decision will be made by the child's healthcare provider and or the local Department of Health. On that note, too, we certainly will be in constant contact with the medical director here in St. Johnsville that we work with through Bassett. We'll be in contact with them and working with them closely throughout this and making sure they're part of the process. And I certainly would urge parents to make sure that they have that connection with their primary care physician or their child's doctor. And we'll do the same with our county or our public health director and our health official for our district. Will there be COVID-19 testing performed at the school? No, there will not be. The district does not have the legal authority nor the capacity to test students. That testing will be something that will be done in conjunction again between the local health department and your primary care physician or the district's medical health director. But no, again, the district does not have the authority, the legal authority, or the capacity to have tests on hand and be doing testing ourselves. What will happen if someone exhibits a fever? There's different frames of when this could happen. One of the things that we're requiring, and it is required of the district, is daily health screenings of students. And we have put this information out. There's a multitude of reactions to it. But the bottom line is from the Department of Health, from the CDC, and from the district is that parents really need to be a partner in these health screenings. We are going to provide a method through either an app or a program here at school, such as Google Forms, that will be submitted each day. So parents will be provided access to this document, and parents will be asked to do the daily health screenings of their students, which includes a temperature check. If that temperature is greater than 100, that student is expected to not come to school and remain home. And there are a couple other questions that will be on the form that need to be answered. But the temperature is a big one when it comes to those daily health screenings. And if that fever, if there is a fever or a temperature greater than 100, then that student is expected to remain home. Again, I can't stress this enough, how important this partnership is, and it very much is a partnership. And we're asking that you perform those daily health screenings and fill out the form. And if there's issues that day with the health of your child, that you're honest on those forms, that you're upfront on those forms, and you keep your child home. I would think that it would be a primary goal of all parents. You know, your child is the most important thing in your life, obviously. But as I look at the students in this district, the 800 students roughly in this district, you know, we care about all of them. And if anybody doesn't perform the health screening, or if they're not honest with the health screening, you're putting a multitude of children and staff at risk. And so I can't stress enough how important it is to be a partner in this process. Understand that we're asking you to be a partner in this process and doing your very best to be honest and upfront with us when it comes to the health of your child on any given day. In the event that a child is not screened at home, meaning that we don't receive the feedback from the parent on any given day, then we must perform the temperature checks. And we will be doing that here at school, you know, prior to or when the student is about to enter the building. And if there is a situation where there's a fever, that student will need to be quarantined. And we will have a place in the building where that student will be quarantined. They will be supervised. And basically the parent will be contacted, and the student will remain quarantined until the parent is able to come pick up that student. They will not be allowed to go into regular circulation throughout the building, regardless of whether they have a mask on or not. They certainly will keep a mask on in quarantine. We'll keep them spaced out in quarantine. We're hoping that quarantine room isn't overflowing. And we certainly will do our absolute best to quarantine them, contact the parent, and have them picked up. If something happens, they enter the building and they don't have a fever, but at some point throughout the day, the student does exhibit a fever. Similar situation if the student went to the nurse, the student would be immediately quarantined. The parent would be contacted to come pick up their child, and they would remain in quarantine until that happened. And again, phone calls would be made to the local Department of Health on what the next steps would be. Again, the phone's going to get picked up. We're going to make those calls, and we're going to do whatever we're told to do. They are the experts in this situation. Will a fever automatically set a quarantine in motion until a COVID test is administered? Basically, the local Department of Health will give direction, as I said, on what the next steps are to follow. We're not in this, you know, making these decisions on our own. Like I said, they're the experts. The phone call is going to be made, and whatever we're told to do, we are going to follow it exactly how we're told to follow it. This kind of bounces back a little bit, but how will the 6-foot social distancing be implemented inside the classroom? To go back to this, unnecessary materials and equipment in all classrooms have been removed to create as much space as possible, or will be removed. We're in the process of doing that. And all desks will be placed 6 feet apart. And again, removing any unnecessary, when I say unnecessary, I mean shelving or furniture or anything in the classroom that is not essential to the learning process, or is considered something that is not recommended to be in the classrooms right now, per the pandemic and per the guidance for the Department of Health. We will safely remove that from the classroom, safely store that, and create as much space as we can in the classroom. I know the feedback might be that's not ideal, especially in an elementary classroom where, you know, there's a lot of things in an elementary classroom you don't see in a high school classroom. But my answer to that is these are unprecedented times. We can't expect there to be reading circles and carpets and small tables where 3 or 4 kids can sit together right next to each other. It's just not possible. And when you have unprecedented times that we're facing, we certainly as a district are facing, you know, unprecedented decisions about what to do with this stuff. But right now, spacing is the most important thing, and being able to keep kids at a safe distance whenever possible. Kind of going back to contact tracing, if there's a positive case in the school, will the school have to close for 2 weeks? And again, that determination will be made with guidance from the local health department based on guidance from the state health department. I can't sit here and say that that's going to be the exact response until we are faced with that situation. We pick up the phone, make that phone call, and we get that guidance from the local health departments. Who will be handling the contact tracing? Again, that'll mainly come from the local health departments. The school district will do everything it's asked to do. We'll do everything we can to cooperate with all contact tracing efforts, and we will keep the documentation. And again, I mentioned partnership between parents and the school, the equal partnership between the local health departments and the school when these situations arise. But we will do everything in our power to assist and cooperate with that contact tracing, but it will not be done unilaterally. That'll be something we'll do in conjunction with the local health department. So I believe that covers the majority of the questions that we received on the health and safety aspect. Before I move on to a different area, I just kind of want to quickly ask the panel if there's anything you want to add in the area of health and safety. Please come up here and do it so they can remove your mask. But
did you want to say anything about if they're traveling right now and if they're going away anywhere?
Well, there are certainly travel restrictions and quarantining guidelines based on travel. I would say, again, whatever we are faced with when it comes to those situations, we're going to do whatever the Department of Health and our local health department advises us to do. There is some mandatory quarantines if you're traveling in certain places around the country. I don't have that list right here in front of me as we speak, but there is a multitude list that the governor has put on I guess you could say a travel restriction or a mandatory quarantine if you do go to those places.
We can put something on the website.
Yes, we certainly, that is something certainly we could put up. I think, there is some weeks remaining here in summer. And on that note, I hope the best you can, you're enjoying the summer and the weather's really been beautiful. But if you are considering travel, you need to be cognizant of that travel list. And again, I think it's a great idea. Maybe that's something we could add to our frequently asked questions page that's on our website to make sure that those are on there so that people know exactly where those travel restrictions are in place.
We have some questions regarding like COVID testing and things like that. I don't know if you want to wait or put the answers to that.
New questions that came in?
Yeah. Want me to go up and answer them? Or
if you want to.
Sure.
Mr. O'Brien, our Director of Student Support Services, is going to take the podium here quickly.
So hopefully I do this right and I have my glasses on. So bear with me, some questions here in regards to health and safety. Let's see, what do I do if my child is showing COVID-19 symptoms? So the answer to that is parents are encouraged to contact your child's doctor if your child is showing symptoms of COVID-19. Your child should not attend school if they are displaying these symptoms. For the most up-to-date list of symptoms of COVID-19, we encourage you to visit the CDC website regularly, and we'll post that website on our district page there. Okay, so another question is, if my child exhibits symptoms of COVID-19, how long will they need to be out of school? And again, we're basing this on the most current information that we have. So from time to time, things will change, or like Mr. Harris said, the county will give us updated information or want us to go a different route. So we'll certainly follow that. But in regards to that question, the district will follow CDC guidance along with the guidance provided by school physicians in the Montgomery, Fulton, or Herkimer counties. Obviously, we talked about, we work with all their Department of Health on allowing a student or staff member to return to school after exhibiting symptoms of COVID-19. If a person is not diagnosed by a healthcare provider, meaning a physician, nurse practitioner, or physician assistant with COVID-19, they can return to school once there is no fever without the use of fever-reducing medicines and they have felt well for 24 hours. If they have been diagnosed with another condition and have a health care provider written note stating that they are clear to return to school. So again, we'll post this on the district website. I don't expect everybody to remember this right now, but just wanted to let you know that we are addressing those questions, and you can look for that on the Q&A on the district website.
Well, thank you, Mr. O'Brien. And he mentioned, and I mentioned it a few times, but it should probably be more clear. We did post on our website last week, I don't know if it was Friday, I believe, an FAQ, a frequently asked questions page. That is going to continue to be updated. I believe as of last week, it had roughly 15 or 16 questions of the ones we're constantly kind of seeing and very common, very good questions. And we'll continue to update it, like Mr. O'Brien said. The website's really going to be the best place for information. We certainly have an all-call system. I try not to overuse it, but and again, these are unprecedented times. So even though I'm of the belief that an emergency call system should be used in case of emergency, I think it would be understating myself when I could say that this certainly is trying times and could be considered in many cases an emergency. So we're going to use that as whenever possible to make sure that you're directed to the website. or that you're directed to your email. And we, send text messages. We provide an email, and we post things on the website and direct you to it with the voice, whether it comes from myself or one of the building administrators, to make sure that you're keeping up to date with the information we're putting on the website. I constantly kind of use the term, I'm not willing to market something until I know I can sell it. So we're really trying to keep things that we're putting on our website, the things that we're confident in, and the things that we're positive we can pull off. And we're really going to try our best to keep the website as up to date as possible, so that you have the information that we're getting. And again, these public forums were something that the governor said he required. We were planning on them anyways. If you see a correspondence I put out before the governor's announcement to even reopen schools, I mentioned right in the last paragraph that we'd be holding virtual parent community forums before he required it. So this wasn't something that is reactionary. I certainly didn't not see the need to do these, and then the governor said I had to, and I was like, all right, well, I guess I got to do them. We were planning these to begin with. He just simply set a date for them to be done by. Other than that, they were something we were already planning on doing, and your feedback is important. And as the questions continue to come in, again, we will continue to address them. I'm going to cover the other two areas, transportation and technology, and then I'm going to end by going to the Google form. I know there have been a few questions that have come in, and I want to do my very best to answer them. I am also of the belief that if I don't have an answer, I'm not going to just make something up. I'm an honest person, very upfront kind of a guy, and I want to give you the truth. So if I'm not able to answer your question tonight, my response might be, good question, I'll find the answer, I'll get back to you. And again, we're collecting your email addresses, and I assure you that we will be communicating with you in some fashion. I want to move on to transportation. Again, we're about 45 minutes in here. I don't want to keep you, this is very important, and there's no such thing as putting a time constraint on these things, but at the same time, I do want to do my due diligence to try to keep these informative and not run on. As far as transportation, will masks be required on a school bus? Yes. The school bus is much more strict than a classroom. All students are required to wear a mask and should maintain appropriate social distancing. The only exception to the mask requirement is students who are physically or mental health would be impaired by wearing a mask and are not required to do so. However, in those cases, the 6 feet of social distance must be maintained from any other individuals on the bus. We know, most of our buses are 65, 66 passenger buses. We nowhere near can fit that many students on a bus. The general recommendation is around 22 students on a 65 passenger bus. You can imagine that creates in of itself challenges for the district when we're talking about busing students. That is why I've said it before, and I'm going to say it again. And I say this in a positive, again, partnership. I encourage all parents who have the capacity to transport their students to and from school to do so. However, I'm also realistic, and I know that's not always possible. Parents work, parents have jobs, parents are involved in a lot of things, and there's no way that that's possible for every student, and we know that. But with the drastic reduction in the number of students we are able to have on buses, and again, there's not something we're able to move around or interpret in any way, shape, or form. It is masks must be worn while on a school bus, except those medical exemptions, and 6 feet of social distancing must be maintained. So again, I ask that to make every effort to help us out by transporting your child to and from school for safety reasons. But if a student does require transportation, the district will be running its transportation, and the district will be following all guidelines in regards to transportation. Another topic while I'm on it, hand sanitizer is not permissible on a school bus. That's again directly from the Department of Health. That is not a OESJ decision. It is not permissible on a school bus. But again, social distancing, mask wearing, all those types of things are certainly requirements that we will follow with no exception. Will there be daily transportation to and from Boces for students in the Cte program? Yes, the answer to that is absolutely. Boces is running their own public forums, and the good thing about these forums is they're recorded and they're posted on our website after the fact. So if you have a friend, a family member, anybody, a sibling that might not be able to attend any of these forums, it's not the end of the world because we're recording them and they can watch them back. So again, after we're able to compile this video, we certainly will get it up to the website no later than tomorrow and make sure that there's access to that at all times. back to CTE, and they're running their own forums, and we'll post those on our website as well, so you have access to those. They are running their program, and they are running an in-person program for the most part, and districts are transporting, including OESJ, to Boces. The only exception, we put out the remote learning form for students that wanted to choose the remote learning only option. Students that are choosing the remote learning only option that are in 11th and 12th grade and attending CTE will only have the option to attend their CTE programs virtually. So if you're not attending regular school here at OESJ, you will not have the capacity to be able to attend the CTE program at Boces either. So there are implications to their remote learning only option, and we did post those on the form. And again, as we continue to get those in, and we'll start communicating with those parents and make sure they're well understanding what they're signing up for and what the implications are if you're choosing the remote learning only option. But for CTE students in 11th and 12th grade, that is one of the parameters. If you're remote learning only, you're only going to be able to attend CTE programs remotely. If you want to go in person, you must attend the OESJ program, and yes, the district will be providing that transportation. However, CTE and OESJ is going to be more lenient, and we'll be working with parents on this about students driving themselves. Many students in 11th and 12th grade have their license, and if parents are signing off on it and providing that permission, we will be allowing students to transport themselves in their own vehicle to and from Boces. Boces is understanding of that. It's going to be providing more parking, more capacity to do that on their end, and we certainly would work with parents on that as well. So I would encourage, if you're an 11th grade, 12th grade student going to CTE and you have your driver's license and access to a vehicle, that you parents consider allowing them to transport themselves. Will children attend the same after-school care between your siblings when you sit together on buses? So basically, the only, when it comes to seating on buses, only siblings or members of the same household will be permitted to sit together. Other students must remain socially distant on the bus and sit in their assigned seat. And obviously, household members can sit together, but obviously, there are ramifications in how many students we can put in a seat. Can't jam 4 kids in one seat. The general recommendation is only 2 kids in a seat. So we're still continuing to do this. And I'm overseeing transportation, to be honest with you. And we're continuing to work out our bus routes and to make sure we have students seated properly. They have assigned seats. They're using the same seat in the morning and the afternoon, and following all the social distancing protocols and mask requirements on the bus. Will I be able to make a call and make a bus change if needed? In order to adhere to guidelines set forth by the Department of Health, the district had to modify its transportation policies. Therefore, daily requests for transportation changes will not be permitted. I know this makes it difficult, and I'm sympathetic and cognizant of the fact that might create some difficulties for parents. But there's absolutely no way to be able to track and move kids around a bus on a whim. When we have an hour to prepare for a bus run with mass changes coming in that normally we take. And usually, I believe we require them by noon, anyways. And it's a limited amount of time. And I can assure you that those bus changes are difficult in normal circumstances to accommodate, but they're absolutely impossible to accommodate. And again, Department of Health has guided districts to not do the daily transportation changes to be able to maintain social distancing and mask requirements and seating arrangements on our buses. How will the school drop-off work for those that are not taking the bus? Student drop-off and pickup for those students not riding the bus is still being ironed out and worked on, I guess you could say. Our goal is to have students entering the building using a multitude of entrances to provide the shortest distance to their classroom. These plans will be shared with parents in the near future. So basically, to sum it up, obviously all buildings have a multitude of different entrances and exits, and we're going to be creative in working out the way to be able to get students in the building to prevent the bottlenecking of students at doors, so they're not standing right next to each other, and using entrances to prevent that, and to also allow students the shortest distance to be able to get to the classroom they need to be in. There really isn't going to be that mingling in the hallways in the morning. We're also working out details with our schedule to try to get students in instruction and started in instruction as soon as possible so that there's not that mingling. Here in the high school, as I was a junior senior high school principal, there was certainly some 15 to 20 minute time period in the morning where students were stacked up in the lobby or the library or in the cafeteria. And obviously those things are not going to be able to happen. So whether it's, working with our arrival and dismissal times or our entrances, we're making every effort to make sure that there's not that bottlenecking or kids mingling, I guess you could say, in the hallway. How does this affect kids that walk to school? Similar to the answer above, we're looking at using our entrances to avoid that bottlenecking, to create the shortest distance possible to start the day. Transitioning around the building is a big topic. We're also looking at materials that we can provide to put on floors to demonstrate, where students should be walking and the direction they should be walking, making every effort to make it one-way flow of traffic in the hallways so that students aren't passing by each other. Per fire code, hallways need to be 8 feet wide to begin with. So if you had students on opposite sides of the hallway, I guess you could say they could pass safely, and they are required to have masks on when transitioning. But just to be, more cautious and to be more following of the guidelines, we're looking to create one-way flow of traffic at all times in our buildings. There are times where that is very difficult, and certainly that it might not be able to possible to achieve all the time, but we're going to do our very best to create that. How will busing work for the elementary? As I kind of covered, busing will be running for both the elementary and junior senior high school students in accordance with all Department of Health guidelines regarding social distancing and capacity. So again, we'll be doing it. There may be some changes to drop off where the buses drop off students at the elementary school and the high school, again, for our use of our entrances. But again, busing will be running for elementary and high school students. Is there a way to place screeners on the bus runs to screen children before they are brought to school? Quite honestly, the district does not have the capacity to provide a screener for every single bus run. Parents will be asked to screen, as I said earlier, their children before putting them on the bus or sending them to school, and any students who have not been screened will be screened prior to entering the building. And if there's any issues, I mentioned the quarantining. There may be other districts providing those screeners, but different districts have different capacity for staff. I also have a fiscal responsibility as the district superintendent to the taxpayers in this district. And while I'm not by any means saying we're not open to hiring more staff to be able to provide the supervision and the means necessary to follow guidelines, I can't certainly sit here and say that just adding an abundance of staff to be able to cover all areas is a possibility. So at this time, and again, I can't reiterate this enough, there are things that are subject to change and things could change as we move forward based on guidance we receive. But at this time, the district does not have the capacity to provide a screener for every single bus run. So that's what I have for transportation. I don't know if anybody wants to add anything there. Okay, I'm going to move on to technology. First question, for families with poor internet service, how will it work for the kids whose internet goes out during a class? It is the district's goal to provide Wi-Fi access for students who lack it, and the district is currently working on a plan to try and address this. Please notify the district technology office if connectivity is or has been an issue in the past. We do understand that this is something that can change. A student could have it one day and not have it the next. And I just ask again, keep using the word partnership, that you communicate with us, particularly our director of IT, Greg Roth, and his staff, but certainly to your building principal if necessary. If it was me, I would CC both, make sure they're both on the email. And when we get those requests in or those concerns in, we'll address them in a timely manner. We do have some Wi-Fi hotspots already in capacity here in the district, and we are working on plans to get more of those Wi-Fi hotspots. Mr. Roth, to give him a lot of credit, he certainly is constantly on the phone with different public entities from Verizon to Spectrum, and they certainly have, those businesses have done things to get creative with how they're providing more capacity to get more people on Wi-Fi since this all started in March. But the district is going to make every effort to provide the accommodations when necessary for parents and families that have issues with internet connectivity. Will my children, grade 7 and 8, have to be on a Chromebook all day to remote into their classes on the days they are home? Luckily, OESJ is a school district that is a one-to-one district, meaning we provide a device for every student K through 12 that needs a device. Certainly, in cases where students have their own device and prefer to use their own device, they certainly can. But if the student does not have their own device, the district will provide and has the capacity to provide a Chromebook for each student. This question is a little bit more specific to the instructional plans that for each building, elementary and high school. And again, that is the topic of conversation for the high school at 4 o'clock on Wednesday and for the elementary school at 6 o'clock on Thursday. I'm not trying to pass it off, but just trying to keep these questions based on the topic for tonight. But we'll get more into that in the instructional plan when it comes to students when they're here and what they'll be doing, and students when they're home, what they'll be doing. Will most work be done on Chromebooks, no exchange of papers, how this affects supply list? Again, I would say this question is more related to the instructional plan forum on this topic, which will be discussed in Wednesday and Thursday's forums. But again, Chromebooks have, before this pandemic broke out, were a fundamental source of instruction here in this district, being a one-to-one district, and they will continue to be, and certainly are a vital piece when it comes to the remote learning piece in the days that the students aren't in session. I would say the packets and the papers are a very difficult thing to accommodate at all times, and we're really going to focus on a more rigorous remote learning program than you saw from March to June going into the school year, whether it's in combination with a hybrid model or in-person model, or if there is a time period where we do get shut down, which I'd be lying if I would say that it's not a possibility, that at some point in time, if the number of cases rise, not just in this district, but regionally or across the state, then it's very possible that the governor could shut us back down and we could go back to a full remote learning option. So we are doing everything we can to make sure that our instructional plans, which again we'll discuss on Wednesday and Thursday, are able to be easily transitioned into a remote learning option so that there's not a huge gap in learning and we can provide that continuity of learning that is necessary. The question on Verizon installing fiber optic cables for internet around the area. Have they said anything regarding a time frame for kids who don't have internet access? We do not have an indication of a specific timeline from Verizon regarding the installation of fiber optic cables in the area. At this time, we have a limited number again of hotspots, and we're looking to provide more. But again, we'll do everything we can to work with the families to make sure that we provide you with that capacity if it becomes an issue. For the families that don't have Wi-Fi or computers because they can't afford it, will hotspots and Chromebooks be provided for the child? I believe I already answered that. We're a one-to-one district. If you need a Chromebook, you're going to get one. And in the case of internet connectivity issues, we'll do everything in our power to provide you with the assistance that you may need in that case. Mr. Roth, I don't know if you want to add.
Just to add to what the superintendent said, we have already gotten to the point where we've assigned every child in the school district a Chromebook by now. We've also taken the precautions of cleaning every one of those Chromebooks. So know that the day that your child is issued a Chromebook, that it is cleaned and is ready to be used. And as far as internet at home, we all understand the dynamics of that with some of the folks being way out and not being able to take advantage of any kind of service from Spectrum or from Verizon. But if we can make a hotspot work for you, we will try as hard as we can to make that happen.
And on that note, with the Chromebooks, what I would say, it's certainly here in the junior senior high school, they're shared frequently. I really think we as a district will certainly have some type of education geared around to students, geared around towards safety with COVID-19 and the Chromebooks and different things like that. So we will spend time in classrooms and in meetings with students, educating them on the day-to-day procedures that are going to have to happen here in our buildings. We don't expect them to just come in and say, all right, I read one poster, so I got it. We understand there's going to be conversations that we need to have, and whether that's coming from administration or classroom teachers, we will be working with students to be able to educate them as much as possible on what these procedures are so they understand them. Again, using the word partnership, I ask that parents are very cooperative when it comes to talking to their children about the importance of following these guidelines and about the importance of making sure that their Chromebook is used by them and only them, and not something that they just pass around to friends. They shouldn't be left laying around with the protocols we have in place. And if they are, there are certainly protocols we could do. Computer related and electronic devices are tough when it comes to cleaning about what you can use. But we've also looked into different products that we can get to help clean computers. And we certainly work with a student if they felt like their computer needed to be cleaned. And we make every effort in that sense as well. Some further questions, just to end with a few questions, and I want to look at the forum Q&A quick. What percentage of classrooms will children be socially distanced enough to remove their masks while learning? 100%. Our goal is to create 100% capacity in all classrooms to maintain desks and whatever seating we're using to maintain 6 feet of social distancing in all directions. And again, if they're able to maintain 6 feet at the teacher's discretion, remove those masks, that is a possibility. What are the consequences of not wearing a mask, specifically at the high school level? Among other requirements, there are strict health and safety regulations by State Education Department and New York State Department of Health that we must follow, that everyone must follow, staff and students. Because of this, the district will be looking to create a COVID-19 insert into our district code of conduct, or a resolution that will be enacted by the Board of Education for students that are non-compliant. And when we're able to get that into our student code of conduct, we certainly will make that very clear to parents. There is a public, viewing that we need to have with the code of conduct for 30 days before we're able to put it into effect. We certainly follow those protocols, but we will be posting that when it's worked out with our Board of Education and our district attorney, our school attorney. We'll be posting that on the website for people to view, and in there will be the specific regulations for what happens when we have non-compliant students. But again, as I've said before, we are going to follow the Department of Health regulations to a T. There will be no exceptions to the rule unless social distancing can be maintained, and that is for the absolute safety of our students and staff. I think we already answered the supply hand sanitizer. Yes, the district has many modes of hand sanitizer on hand. Question on bathroom breaks. Again, that's something that'll be worked out in our instructional plans, and we'll be talking to students, we'll be talking to staff. I can assure you that it's not going to be a free-for-all with students just randomly getting up to go to the bathroom. It's an important thing for students to have to do throughout the day, but there will be protocols and procedures put into place to prevent bottlenecking of any kind in bathrooms. And obviously there'll be cleaning that needs to take place, and when that's taking place, bathrooms won't be available. So that'll all be part of the instructional plan and how we work on students going to the bathroom. But again, I can assure you it's not just going to be a free-for-all with kids just getting up and going to the bathroom when they want to, because that certainly could create safety issues when kids are using the bathroom, and when they are, masks are required. And just some of the points, individuals that have demonstrated a fever need to be fever-free for 24 hours without use of medication to be able to return. But again, that will go in conjunction with guidance we receive from local health departments when we have a case where a student might be demonstrating symptoms of COVID-19. We're going to do it, like I mentioned, hand washing. We're going to do everything in our power to educate students, to post signage around the building and provide every opportunity for students to be able to wash their hands. And again, where soap and water and washing hands is not possible or available, hand sanitizer, while not recommended to replace hand washing, will be available. As far as use of dividers in classrooms, they're not necessary or required when students are maintaining 6 feet of social distancing. So again, if they're maintaining 6 feet, which is our plan, the dividers are not required. And if they can't maintain 6 feet, they'll wear a mask. As far as do we have enough teachers to spread the students out? I mean, the district is obviously looking at how many students will receive remote learning option instruction. And then we look at breaking down the remaining number of students into sections to allow for social distancing. At that point, we will know if we need staff or teachers to assist in the spreading out of students. Again, I mentioned there may be a need to hire additional staff, but that certainly cannot be a free-for-all as well. Will lockers or cubbies be used? No. We are not permitting the use of lockers or cubbies. It creates, again, the lockers are very close together. It's tough to stagger when kids will be going to lockers. And this certainly cuts down on students congregating together. I understand there may be some parents that are concerned about what the students will be carrying around with them during the day. And again, that's something we'll be working with our teaching staff and subsequently with our students on recommendations for what actually needs to be carried so that they're not carrying around a substantial amount of material. I know in the junior senior high school, it's always been a rule that you can't carry a backpack or a book bag around with you during the day. We certainly would look to be lenient on that rule as well, if that's needed to provide the capacity for students to be able to carry their stuff safely around the building. We certainly don't want any students having any physical issues or injuries because they're carrying a large amount of stuff. But again, we feel confident with guidance, we can maintain a limited number of resources that they're going to have to actually carry around with them to prevent that from becoming an issue. So for the sake of time, will there be someone to screen children being dropped off by parents that are not riding transportation? Yes. If the student wasn't screened at home, but I go back to that partnership, I would really ask that parents cooperate with us on the home screenings and be honest on those home screenings to accomplish that screening at home before the student gets to school. But if a student arrives to school from drop-off and the screening has not been conducted, the district will be providing that screening here at school before they're allowed to enter the building. So I think that pretty much covers. Again, if something happens, I did not answer your question, and it's in the top area of health and safety, of transportation or technology, we're not ignoring anybody. Hundreds and hundreds of questions came through. I individually went in and pulled the questions that fit in these categories out, and I'm a human being. If I miss something, please, you can email us. You can let us know that the question wasn't answered, and whether it's in a subsequent forum later this week, or whether it's personally through a phone call or email, we want to make sure that your concerns and questions are answered. Does anybody on the panel have anything else? I mean, there's a number of stuff on here, but
No, I think some stuff Wednesday we'll get to.
again, Mr. O'Brien said that if we realize something that wasn't answered or covered, we can always start out Wednesday's session, even though it might not be on the topics. We could always start that session out covering and going back over some things that we may have missed. I do quickly want to go to the.
We can read you a few of them.
Well, I have it right here.
Okay.
I'm just going to look at some of the things that are on these topics from tonight. Again, some of these questions, I've already seen questions that are more appropriate for Wednesday or Thursday. A question on a child having allergies. We obviously know that's a very predominant situation that adults and students alike deal with. Allergies are not a medical condition that would be a reason why the Department of Health would recommend a student not attend school. But obviously it certainly does create an issue, and I understand that. We understand that. But what I would tell you is work very closely with you as the parent and with the school nurse and with your doctor, your child's doctor, to make sure that we're providing as safe and as comfortable as an environment for them as possible. But it is not considered something that they should not be attending school because of allergies. We would just work very closely with you and do everything we can to make that student comfortable. Again, I'm skipping over some that are more instructional. I think we covered the traveling. It depends where you're traveling. If you did travel to a place that it requires a mandatory quarantine, then yes, that quarantining will be expected. I would ask again, honesty. Tell us if it's a trip you've decided to go on, and you've gone into an area that requires a quarantine, that you notify us. We again would work with you and the Department of Health, the local health departments, to determine what the necessary protocols would be moving forward. I've seen a variety of plans. I've inundated myself, I think, looking at different plans. And I guess the key point there is, while other districts may be doing something different than ours, I don't believe they're doing things different than ours when it comes to what we're discussing tonight. For the most part, especially the health and safety piece, those guidelines come to the Department of Health, and there's not much leeway on those. But yes, we do certainly consider other plans, but certain things are unique to certain districts. And I can't stress enough that just because it works somewhere else doesn't mean it can work here. But that doesn't mean that we're not looking at those, taking ideas and considerations into mind while we finalize our plan. Are students allowed to bring their own hand sanitizer to school and attach to their bags? Yes. I again would ask that they keep that to themselves, that's not something they're sharing. Should not be a community hand sanitizer. We provide a multitude of options for them to have hand sanitizer throughout the building. But if that's something they choose to do, I know that's already things that students do in the past. So there wouldn't be an issue with that. As far as number of students on a bus, and does that mean numerous bus runs? Not necessarily. Again, I'm overseeing transportation. It's probably one of the heavier lifts that we have in our district to be able to accommodate with the Department of Health guidelines. But it does not necessarily mean that there'll be numerous bus runs. We did a transportation survey, a lot of responses. Again, and I say this being sympathetic and respectful, if you could transport your child, I would ask that you look to do that. But if you're unable to, we will provide transportation. Does not mean that's going to require numerous bus runs or necessarily double tripping where we're running buses in and then back out and then back in. We're looking at those options, but we're hoping for a multitude of reasons to be able to provide transportation that doesn't necessarily create numerous runs to be necessary. So as far as the questionnaires, the daily health questionnaires, it's a good question. The parents will be able to complete those. We'll provide you with a method, a means to be able to complete those and submit those. It's not going to be something you have to send in with your child. It'll be something, whether it's a Google form, which this question and answer sheet is, or whether it's another app that we're able to use. And if something happens, those are not able, or you don't have the capacity to be able to do those for whatever reason, whether it's connectivity issues or whatnot, just let us know ahead of time, and we'll certainly try to determine the modality that we're going to use to receive those daily health questionnaires. But those should be something you should be able to do at home and submit, and it's done, and we're able to see them on our end, and it's kind of seamless. And then we're able to quickly see who did and who did not submit response to that daily health questionnaire. Again, a lot of these questions are pertaining to topics on Wednesday and Thursday. So I'm not ignoring your questions by any means. As far as pickup and drop off times for bus runs, again, that's still being determined. Taking in the information from the transportation survey and the remote only learning option. We need to take those into consideration before we start making seating assignments and arrangements on a bus. So again, as I said at the beginning, and we're standing on August 17th. It's probably difficult as a parent to sit and hear a superintendent of school say, I ask for your patience, but we're dealing with so many things coming at us, and we're trying to do our very best before we put something out definitive. And we have all the information possible, keeping health and safety as our number one priority. So as soon as we have those answers, we're going to get them to you. School supply list question. I know that's probably a little bit more particularly elementary school. I know we haven't put anything out yet.
We got a question in 7th and 8th grade supply list too. So it's just, we're waiting to see what we're going to need.
Yeah. So again, we're as we finalize that instructional plan, we'll give you more clear-cut guidelines on what those supply lists are going to be required and what your students would be expected to bring with them on the first day of school. And we don't plan on students sitting on buses and waiting. We certainly, our bus runs, we have a large district that spans many miles, and we certainly understand that in normal circumstances, students are on the bus for a substantial amount of time. But we certainly don't want students sitting on the bus for that long of a time period. So we hope to get students on a bus and here in a similar fashion that we have in years past, and prevent them from sitting on the bus for a substantial amount of time. But obviously, because of the distance and square miles that our district covers, there is some long bus runs to begin with, and it's somewhat unavoidable. So we don't look to make that, we're not looking to make that worse, put it that way. So that's all I'm seeing on the parent form. And again, we've been going for over an hour, starting well over an hour at this point in time. Does anybody from the panel have anything they want to add? So again, 2 other forums to be held. We have the next one again is this Wednesday, the 19th at 4 o'clock. And that one will be focusing on pre-K through 12 special education students instruction and instruction and the instructional plan in the junior senior high school for grades 7 through 12. Certainly, I might not be speaking as much, and I might defer a lot of those questions to our junior senior high school principal and to our director of support services. But I certainly will be in attendance as well, and there will be a panel. And then the final forum for now will be on Thursday at 6 p.m., this Thursday at 6 p.m., and that'll be the pre-K through 6 instructional plan along with food service, more specific questions to food service. So I want to assure you too, the governor said we had to have 3 forums. I will stand here before you and tell you if there's a need for more than 3 forums, I am absolutely willing to host them and continue to have them until your questions are answered. As we get more specific information to you, it's going to probably do two things. It's going to help to answer some questions, and it's going to help to create some questions. And we realize that. So we will continue to monitor this forum. We're on it daily and continue to update as the questions come in. And again, if something happens, I didn't answer a question that was on the topics tonight, I personally apologize. It was not intentional. I didn't even look to see who submitted what questions. I was just pulling the questions. So certainly it's not intentional. And if we fail to answer them, please reach out via email, or you could re-add the question on the forum, because again, we are certainly paying very close attention to it. But email is probably the best form of communication if you feel there's a question in an area tonight that hasn't been answered. If it's not on the topics tonight and it's something more specific to what's listed as the topics for conversation on Wednesday and Thursday, I ask that you be patient and wait to see what you hear on Wednesday and Thursday. We have a large number of questions on the instructional plans, and we certainly want to answer them, and we will do those on Wednesday and Thursday. So please be patient, understand that those questions certainly may be addressed on Wednesday or Thursday. I want to thank you. I know your time is precious, and again, I assure you that everybody in this room, on this panel, the teachers and staff members in this district are taking this very seriously and are in constant communication with building level administrators and myself as a superintendent. And I'm working very closely and very well with the staff in this district. And we all take this extremely seriously. We care about what you have to say. We care about your questions and concerns, and we want to do everything in our power to certainly make this nothing short of a well-working partnership. So I thank you very much. I appreciate your time. And if you have further questions, don't hesitate to reach out. Have a great evening.
Where are you supposed to look when you're speaking?